Is there any way to lift my eyelids without getting general anesthesia? Is there any mini surgery? My eyelids are really floppy and I want to remove the excess of it. I have eyesight problems, -3 both eyes.
Thank you for your question. You're asking if it's possible to have eyelid surgery without general anesthesia. And you state in your question that your eyelids are floppy and that you also have vision issues, and you state that your prescription is -3 for both eyes. Well, I can certainly help you with that. I'm a board-certified cosmetic surgeon and fellowship-trained oculoplastic or oculofacial plastic surgeon, which means that my first area of training was in eye surgery before advanced training in cosmetic and reconstructive surgery of the eyelids. So, in addition to notice that I've been in practice in Long Island and Manhattan for over 20 years. Well, I can certainly tell you that it is very much possible to have eyelid surgery without general anesthesia. This was one of the things that I really advocated from an early stage of my career over 20 years ago. And it has been always my observation, and of course this is a controversial issue, but I've always observed that in the field of cosmetic surgery, that many of the challenges with patients' experience and recovery had more to do with anesthesia than it had to do with the actual surgery. So what I developed over this time frame has been a system where we do routinely perform cosmetic upper and lower eyelid surgery, facelifting surgery, liposuctions, breast augmentation, hair transplants, all under local anesthesia with light sedation. So in terms of eyelid surgery, what we do for our patients routinely is, and just to describe what a patient's experience is like, is we have our own Joint Commission approved facilities in our offices in both Manhattan and Long Island. What this means is what we've done is replicate the standards or utilize the standards of safety used for hospitals and surgery centers and created facilities where we have everything as if we were in a hospital. Eyelid surgery is actually very straightforward. Performing it under local anesthesia or with a little bit of sedation is not that difficult in the hands of someone with a lot of experience and facility in doing the procedure. So it is routine for our practice for our patients to do upper eyelid surgery, such as what would be indicated for you in this type of situation. We don't do general anesthesia for this, and we have a facility. So we kind of have the best of all worlds in doing that. I would also add that recovery is considerably faster this way. The reason for this is that when people have general anesthesia, they basically often wake up coughing or they may be nauseous from the medications. With sedation, that really doesn't happen very much at all. We don't use opioids in our practice for sedation. We don't feel a need to. It's available if we have to, but really it's been many years since we've had to use these. And these are the drugs that are like fentanyl, demerol, codeine. These are associated with postoperative nausea and vomiting. So by eliminating the opioids altogether, there's been no problem. So to answer your question, the answer is yes, it is possible, and that the results can be very nice and the recovery can be much easier. So with that being said, I recommend you meet with qualified, experienced cosmetic surgeons who are comfortable with performing the surgery in this way, and find someone you're comfortable with, that you like the results in terms of before and after pictures, and that it is very important, in my opinion, that people really feel comfortable with their doctor and that they feel like the doctor gets what they want. You know, as a specialist, I do revision eyelid surgery for patients from around the world, and very often I feel like there's a disconnect between what the patient wants and what the doctor believes they want. And it just takes time to develop this type of rapport and have this clarity of communication. So I hope that was helpful. I wish you the best of luck, and thank you for your question.